Prevention and treatment of lung cancer. Treatment for lung cancer varies according to age, type of cancer, extent of disease, tolerance to medication, and patient preference. Treatment of lung cancer can involve a combination of surgery, chemotherapy, targeted therapy, immunotherapy, and radiation therapy, as well as newer experimental methods. Chemotherapy refers to the administration of drugs that stop the growth of cancer cells by killing them or preventing them from dividing. It can be used alone or combined with radiation therapy. Chemotherapy is given through an intravenous infusion. A combination of drugs is given in a series of treatments called cycles over a period of weeks to months with breaks in between cycles. Chemotherapy may be used before surgery to shrink cancers and make them easier to remove, before or during radiation therapy to make radiation therapy more effective, after surgery to reduce the risk of the cancer returning, and in people with advanced lung cancer, chemotherapy can be used to relieve pain and other symptoms. The side effects of chemotherapy vary according to the dosage and combination of drugs used and may also vary from individual to individual. Side effects include anemia, mouth ulcers, hair loss, nausea and vomiting, and a higher risk of infection. The side effects generally disappear during the recovery phase of the treatment or after its completion. Radiation therapy. Radiation therapy uses high energy rays to kill the cancer. Radiation treatment focuses on only one area of the body. Radiation therapy may be given as curative therapy, palliative therapy, or as adjuvant therapy in combination with surgery or chemotherapy. During radiation therapy, you lie on a table while a machine moves around you, directing radiation to precise points on your body. Radiation can be used either externally by using a machine that directs radiation toward cancer or internally through the placement of radioactive substances within the area of the body where the tumor is localized. If surgery is not an option, combined chemotherapy and radiation therapy may be the primary treatment. Combining radiation therapy with chemotherapy can further prolong survival when chemotherapy is administered. Side effects include fatigue, lack of energy, a reduced white blood cell count and low blood platelet levels, nausea, vomiting, and diarrhea. Surgery. The surgical procedure chosen depends upon the size and location of the tumor. Types of lung surgery for lung cancer include wedge resection to remove a small section of lung that contains the tumor, lobectomy, one lobe of a lung is removed, pneumonectomy, one entire lung is removed. During surgery, nearby lymph nodes will also be removed to see whether the cancer has spread. Knowing if the cancer has spread to the lymph nodes also helps the doctors decide whether there is need of further treatment with chemotherapy or radiation therapy. Targeted therapy. Using drugs that attack specific features of cancer cells known as molecular targets to stop the cancer growing and spreading. Targeted therapy can often be given by mouth as tablets or capsules. These drugs can be highly effective, but they will only work if the cancer contains the particular gene or protein, and even then they do not work for everyone. Side effects include acne-like rashes, tiredness, diarrhea, nausea, or vomiting. Immunotherapy. Immunotherapy uses the body's own immune system to fight cancer. It's a new cancer treatment approach that uses drugs, vaccines, and other therapies to activate the immune system's natural defenses so it can fight cancer. Immunotherapy may be an effective option for some patients with advanced lung cancers. Immunotherapy drugs work by strengthening the activity of the immune system against tumor cells. Immunotherapy drugs, known as checkpoint inhibitors, block proteins, stop immune cells from recognizing and destroying the cancer cells. Once the proteins are blocked, the immune cells can recognize and attack the cancer. Side effects include inflammation of any body organ, which may lead rashes, joint pain, and diarrhea. Palliative care. Palliative care, also known as supportive care, is specialized medical care for people with serious illnesses such as lung cancer. People with lung cancer often experience signs and symptoms of the cancer as well as side effects of treatment. Palliative care focuses on providing relief from symptoms, pain, and stress. The goal is to improve quality of life for both the patient and patient's family. It can be used at any stage of advanced lung cancer to improve quality of life and does not mean giving up hope. Rather, it's about living us as fully and comfortably as possible. Palliative care is provided by a team of specialists such as palliative care doctors, nurses, social workers, and others. The team works in partnership with the other healthcare providers to manage the pain and symptoms. The palliative care team provides communication and support. It can manage the side effects of chemotherapy, such as nausea, vomiting, pain, fatigue, diarrhea, depression, anxiety, and sleep problems, and can be helpful in managing pain after surgery. Alternative medicine. Complementary and alternative lung cancer treatment is used in addition to standard treatments to help relieve cancer signs and symptoms. Examples include acupuncture, dietary supplements, massage therapy, hypnosis, and meditation. Acupuncture. It involves the insertion of very thin needles through patient's skin at strategic points on the body. It may relieve pain and ease cancer treatment side effects such as nausea and vomiting, but there is no evidence that acupuncture has any effect on cancer. Massage can help relieve anxiety and pain in people with cancer. During meditation, patient is focusing his mind on a particular object, thought, or activity to train attention and achieve a mentally clear and emotionally calm and stable state, which may reduce stress and improve quality of life. Hypnosis is usually done with the help of a therapist using verbal repetition and mental images. It may reduce anxiety, nausea, and pain. Yoga combines gentle stretching movements with deep breathing and meditation. Yoga may help people with cancer sleep better. Talk to your doctor about the risks and benefits before you start any kind of complementary or alternative medicine. Follow up care. Care for people diagnosed with cancer does not end when active treatment has finished. All cancer survivors should have follow up care. Follow up care for cancer means seeing a healthcare provider for regular medical checkups once you are done with treatment. During follow up care, healthcare team will continue to check that the cancer has not come back, manage any side effects, and monitor your overall health. It includes regular physical examinations, medical tests, or both. Healthcare team will work with you to decide on follow-up care to meet your needs. Follow-up after treatment is an important part of cancer care. Each patient has a different follow-up care schedule. How often you return for follow-up visits is based on the type of cancer, the treatment you received, your overall health, including possible treatment-related problems. Follow-up visits for lung cancer are usually scheduled 3 to 6 months after initial treatment, then every 6 months for 2 to 3 years, then once a year for 5 years. Outlook. Lung cancer is a serious illness that can be fatal. Non small cell lung cancer is the most common type. Survival rates vary widely depending on how far the cancer has spread at the time of diagnosis. Early diagnosis can make a big difference. The outlook for non small cell lung cancer is usually better than that for small cell lung cancer. Cancer affects everyone differently, and it's not possible to predict any individual outcome with accuracy. Complications can result from both the cancer and the treatment. Some are temporary, but others will last or worsen over time. Some complications can be life threatening. There are ways of managing complications and helping a person maximize their quality of life. Thank you.